My name is Aaron Schulenberg, and I'm the Executive Director of the Society of Collision Repair Specialists, and we're live from the 2022 SEMA show, and we're at the SCRS booth, and I'm joined by two individuals who are joining us this week specifically to help our members learn more about accessibility of healthcare for the collision repair industry. So we've got Kevin Dunn, CEO of Decisely, and we've got Abir Sen, who's the co-CEO of Gravie. And SCRS launched in September our newest SCRS healthcare plan for our members, and both of these gentlemen played an integral role in helping to make that happen. So we want to talk a little bit about the journey and about where that came from. So Kevin, it was probably 2018 that our company started talking for one reason. Our members were coming to us saying, our healthcare sucks, we want something better, and we want to pay less. And that was kind of the driving charge that we sought out to find a solution for.
Sure was.
So Decisely's been an awesome partner in making sure that we were able to do that. So can we talk a little bit about what the mission is of who is Decisely?
Sure.
What's the mission? What do you guys do here?
Yeah, as you said, is four years in a pandemic ago, we started this endeavor. And what Decisely does is that we work with small businesses. And so we understand the pain and suffering associated to health insurance with small businesses. Small businesses pay higher premiums typically than a large group because they're underwritten in smaller entities. And so, just one healthcare issue can, raise a premium by 10, 20, 30% year over year. And so what we wanted to do with you was to put together the collision repair industry itself into an industry vertical in which has many players. I think you've said as many as 15,000 businesses here in the US that do this, is to take them and look at them in aggregate so that you can buy basically like a Delta Airlines or a Federal Express and buy as a larger group entity and look at it that way. We started this 4 years ago and we had some traction. The reality is that what we were really looking for is that we have the technology, we have the solution, the customer service to talk to the small businesses, but what we needed was a product offering. And then that's what led us to Abir, is that he and his company have done a fantastic job of bringing affordable quality healthcare into this type of vertical and making it so that the employees themselves see the savings just like the employer does, and makes it streamlined and efficient and easier than the typical healthcare program to take the friction out of the system.
Well, and I think what's interesting about that is there were a lot of solutions in that time period, right? A lot of things that you guys brought to the table and we took a look at and said, okay, maybe this fits. The problem was we're a national group and it fit for maybe a specific market. We were really uncomfortable with that idea of saying, hey, some of our members, we've got something for you, and the rest of you, sorry, we don't. Or they were programs where they looked great on year one and they just didn't look all that sustainable going forward after that, or they weren't things that we were comfortable putting our brand on. And we wanted to find that perfect one where it wasn't just more affordable, it was more affordable and it was better, right? And so that led us to you all at Gravie.
Yeah, we were thrilled to have the conversation with you guys. We started Gravie about 9 years ago, so we have business in about 40 states, so mostly a national solution. And I'll give you a little bit of the founding story. And when we started with health insurance, it's very expensive for most businesses. People spend $12,000, $15,000, $20,000 per employee per year. And on top of all that expenditure, no one wakes up in the morning and says, I love my health insurance. So our challenge was, can you actually create a health insurance plan, a health plan that people can love? And one of our hypotheses is why people don't like their health insurance is they always feel like they're being nickel and dimed. So you have all this money that goes out in premium, but then you may have a $5,000, $7,000, $10,000 deductible. So people feel like they don't have health insurance. And if you look at the data, that actually turns out to be the case. So in any given year, over 90% of the expenditure of the employer dollars goes to benefit less than 10% of the employees. So in a very real way, people actually don't have health insurance. So we decided to flip the script on its head and said, look, most of the things that we know are going to happen to you, about 85% of the healthcare encounters, they should just be free. Because if we know they're going to happen, by definition, they are not insurable. That should just happen. So we created a plan that all your, primary care, your specialist visits, urgent care, drugs, all of that is just covered by the plan at no extra cost. And there is a deductible only for a handful of things like inpatient hospitalization, some specialty drugs. And then, something really interesting started happening where we saw a change in people's behavior. They were going to the doctor more. they were getting more drugs. The drug adherence went up, and their emergency room visits went down. So exactly the kinds of things that you wanted to happen happened because we removed the obstacles and barriers from people's ways. So we are thrilled to work with SCRS and look forward to the journey ahead.
Well, I think what's so cool about that, it's a really competitive market out there for employees, right? And we struggle with attracting and recruiting new technicians into the industry and all of those types of things. And when, as the employer, if our employees are picking their spouse's health care, you're not necessarily being the employer of choice because they're not as tied to your business. And when you can take way better coverage like that and put it out as a small business and compete, I just think it presents a really great opportunity for these small business owners.
Yeah, absolutely. I mean, the reason that employers spend so much money on benefits is to make their employees happy.
Yeah.
So it doesn't make sense that they're doing all of this and employees are not happy. That is not sustainable. So absolutely right, Aaron.
And in our research in many different verticals is that what we found as well is that if you offer employee benefits and you have health insurance as a part of it, is that your employees are likely to stay with you 3 times longer than they typically would. And so it's a 3 times aspect because in this economy, everyone's, there's a talent war out there, and to draw people into these types of industries as well. So we're super excited about it, and it's great having Gravy and a beer on the board because it's like for an insurance company to encourage people to go to the doctor.
Yeah.
Is that as Gravy said is that that these no zero costs for going to get an imaging, et cetera. People look at that and say is that other insurance companies put up barriers. They put up a $35, a $70 barrier that you have to take your credit card out every time that you go to the doctor. It's not here. We encourage you to do it. You should be doing it. That's how you get preventative health, and it works over a long period of time.
And it honestly feels a lot like what healthcare used to feel like a long time ago, right? And I think there's just something really, our industry is all about helping the community, helping people get out of difficult situations, and really, I think that's what this product is doing for the businesses that we represent. And I think there's something nice about, I had one of the early adopters in the plan who switched over, called me and said, I have a technician. His wife is pregnant and they're expecting a child. We did an analysis between our existing plan and this new comfort plan. And our employee is going to save almost $6,000 in out-of-pocket expenses. I mean, that's meaningful to what we can do for people's lives. And on top of that, so the coverage is significantly better from what we've seen than what most people are able to accomplish on their own. All those no-cost services really do matter. They do allow them to kind of use it right out the gate. But we're seeing some pretty tremendous savings. I don't know if either of you want to talk about that, but I think for the businesses who said I can't afford it or I can't afford it, it's not sustainable for me to continue to offer what I have available to me. If I can save 10 to 15%, that's a huge savings for a lot of these employees.
Yeah, absolutely. And we see that often in our book of business where employees will save up to $100 per month. Over the plan they would have from last year from some legacy carrier. But the beauty of that is, while they are saving money and having a better experience, we are also actually being a good business because they're doing the kinds of things that makes them healthy.
Sure.
So it is really works for not just the employee, it works for us. And it's a way of just aligning everyone's incentives versus always being like, if you win, I lose. If I win, you lose.
Yeah,
absolutely.
What's also great too is that as we've seen the adoption the way it is that the businesses that are saving $5,000, $10,000, $15,000, they're not pocketing that in margin. They're actually saying, is that I didn't realize if I'm saving that much, can I get vision? Can I get dental? Can I put a life insurance policy in for my employees? And so they're taking that money and reinvesting it into people, which is key to everything, which is to a healthy lifestyle, et cetera. So we love seeing that as well, where it's bettering a company and helping from the employee perspective.
I was talking to a member earlier today who said, everything that I gain from that healthcare, I'm going to reinvest back into 401k solutions for my employees, and that's exactly what we want to see. We want to see these businesses growing in what they're able to offer and be able to really deliver a meaningful career to people who enter into the collision repair industry. If you had one piece of advice for a small business in our space who was kind of curious, what would that piece of advice be?
Get a quote. It's simple to get a quote. There is no cost for getting a quote with us. And the other thing is that the definition of small businesses, is that, you know, a lot of people think a small business is only 5 employees or 10 employees. Small businesses in the US, as it's classified, that we can help with a Gravy solution, you know, 2, 3, 400 employees, you're still small enough for this type of solution. And I think that's been an eye-opener here at SEMA, is where, you know, several have come up talking about they have, you know, family members that are running another part of their business, and they're saying, oh, well, I'm going to put these, and then they realize, oh, you mean my organization can do it too? I'm 200 employees. It's like, absolutely. This is, you know, this shoe fits it all.
We've seen that with businesses who support collision repairers, right? So paint distributors or small manufacturers, things along those lines, who are members of SCRS and who can certainly participate as well. So your recommendation was get a quote. Should they wait until they're ready for renewal, or should they start looking now?
You should always start looking now. You know, you start at least, you know, 3 months before your renewal, because you've got all kinds of things thinking about. And besides that, who wants to talk about health insurance? And so, you know, if you wait to the last minute, you're literally going to wait till hours before, and it's too late.
Yeah.
And, you know, so get out there, get the quote. It's really simple to do. You know, we can get it for you back in 3 to 4 days at tops.
Yep. I don't encourage this, but I will say, and kudos to both of your teams. We had a business who was here, who's up for renewal, I think next week, and they were able to get a quote turned around so quickly that they could make a good decision. So that was cool. What would your advice be?
I think what I would say is that as a small business owner, you know, you obviously pay attention to everything that you write a check for. You want to make sure you get value for your money. And health insurance is probably a pretty big check that you're writing. And if you haven't written it in the past, you're going to write a big one when you have health insurance. Just have the same level of rigor in evaluating what that money is going towards. Don't take the industry standard for granted and say, well, that's the best that I can do. I think there is better, and hopefully we think we have a solution that's better. But even aside from us, just, you know, looking at it with the same level of rigor that a small business owner looks at all other expenses would be my advice.
Okay, good. I think there's something that stands out about this for me. So many of our members, they are small businesses, and their position in the community or to their customers is, you want to deal with somebody where you're talking to the owner, right? You're talking to, I am my business, and you get to interact directly with me rather than some giant corporation who's going to be fixing your car. I think there's something to be said for the fact that we have the CEO of our provider and the CEO of our broker both in our booth, because you guys wanted to come interact with our members. And I think there's a lot of analogy there to the types of businesses that we are and who we want to do business with. And so if you're interested, there's never been a better time to find solutions for your employees and for your business. Take advantage of those savings and providing enhanced coverage for your employees. So guys, I want to thank you. Appreciate you being here.
Thank you. It's great to be here.
Yeah.
We love it.